Thank you very much. I am Elaine. I am a nurse by background, but I spent about 20 years working in healthcare education until late last year when I decided to leave and become a full-time PhD student. So part of what I'm going to talk about today is work that I'm doing within the PhD. Just for anybody that's here, I have put the slides in the chat, so they should be right at the very top of the chat. If you want to look in there, you should be able to find them. Okay, so, and also we're going to be using Padlet at some point, and there's the link on the first slide, and also there's a barcode on there a QR code that should take you to the Padlet as well. And I think Flo was going to put it in the chat as well. Right. Okay. So just start off just talking a bit about learner agency. How the definition I've selected for it is the feeling of ownership that students have over their learning and their capacity to set their own goals, which I think is quite a nice, succinct definition. Within health professions education, I would also extend that as well to say, the desire and capacity to act in ways which influence patient care, because obviously we're training people to look after patients, and patient safety and safe patient care are the ultimate aims of what we're doing. Its relationship to active learning. Active learning approaches are very important as ways of generating agency. And we use a lot of different things within health professions education: case-based learning, problem-based learning, quizzes, and a few other sorts of quite, group work, some quite sophisticated things as well, which I'll come on to a little bit later. And the research on this, there's not so much on adult learners as there is on younger learners, and there's not really that much that's been published about health professions education specifically. So hence it's an area that I'm looking at to try and find out a little bit more. So what else can we say about it? Health professions education has some specific issues or constraints, however you want to phrase it. That firstly, we're not just educating students within the university setting. We're also educating them within clinical settings as well, and they're assessed in both theory and practice. So the university tends to cover the knowledge on often a very wide variety of topics, and also some skills teaching. So, for example, we may teach somebody how to give an injection, and we'll gradually build that up from using something artificial to give the injection into, to putting that into a context, and then gradually students will go out and apply that skill in practice under supervision. But the practice is very much the application and the practical side, and the university tends to cover mostly the theory. We also have some very diverse knowledge and skills requirements. So it's not just about knowledge of health or about diseases. We also cover things like ethics, empathy, the legality of drugs administration, lots and lots of different things, very, very broad. And we also have two sets of professional body requirements to meet, as well as university requirements. Obviously, anybody teaching in a university has to meet university requirements, but we also have professional bodies, and their job is to provide the standards of education and practice that we have to meet when we write a curriculum, and to also make sure that they're happy to validate the programme, because they feel that we've covered everything that we need to within that curriculum. Because once somebody qualifies, they will get their university degree, but they'll also go onto a professional register. And there's some very strict things in some of those requirements, like the amount of attendance that students have to have, whether it's face-to-face, and so on. So we've got some additional things that we have to meet. And in terms of focus, as with anything else, we want students to gradually move from being dependent to independent learners and being able to, look after their own learning, ultimately become lifelong learners. We have some very diverse student groups. We don't get that many people who are 18-year-olds. We get a lot of people that are older, often into the 40s, many coming in with non-standard entry qualifications, and also some quite specific requirements like issues with childcare and so on. So we get quite a variety, and we've got a lot of degree apprenticeships and often very large student numbers on some programs. So I'm just providing that really as a bit of a context for you to understand, how things work. The piece of research that I want to delve into was done last year between August and December 2023. And it involved me interviewing 9 participants from 8 different health professions. And I've listed the professions on there. The one I will explain that you may not have met is operating department practice. And that is people who are trained to work alongside surgeons and anaesthetists within the operating theatre or the operating department, depending on which country you're from. And they either work in anaesthetics, in surgery, or in post-operative care in much the same way that nurses would do. But it's just a different route into that work. There were 3 questions that I wanted to answer with the interviews, which I've listed on the top of the slide as well. So I had roughly half and half, male and female, 60-minute interviews with a visual elicitation. So I asked them to bring along a picture that represented good teaching for them. And that started off as, the point from which we generated the interview, and it got us into discussion in quite a nice way. The data was analysed using reflexive thematic analysis with inductive coding, and there were 3 themes that came out of that. And the people that was interviewing were mainly teaching undergraduates, but some postgraduates, and experience in higher education varied between 3 and 20 plus years. So the themes that came out are shown on the bottom, and I've called them lenses rather than themes because each seems to be a particular way of getting a view on the interviewee's world. I'm not going to go into each of the themes in any detail. I'm just going to pick out relevant bits that are to do with agency. But there was definitely a lot came out about they felt themselves still to be healthcare professionals. They definitely questioned whether we were doing educational training with some aspects of health professions education. And there was a lot of discussion around attitudes and behaviours, both of the university, the students, and also some of their educational colleagues in practice or within the university. There were 2 meta themes, as we called them, that bound all of that together. So professional identity underpinned everything, and reflection was something that was very, very important as well. And I'll say a little bit more about those as I move on to the next slide. So what I found was that the interviewees all identified primarily as health professionals rather than as university educators. So somebody might say, well, I'm a nurse, but I work in a university, or I'm a doctor, but I teach in a university. And the way in which they interacted with their students was very much driven by the way that they interacted with patients. So they saw their students as somebody to whom they owed a duty of care, and who they were moving from being dependent on them to being independent in the same way as they did that with patients as patients got better. So a lot of active learning. The midwifery course was entirely delivered by case-based learning, for example, but a lot of other things as well. The obvious things like, group work and quizzes and so on. But also a couple of other things that I put pictures on the right-hand side. So the bottom is a bariatric suit. So it's a weighted suit that you can wear to experience what it might be like to be sort of very overweight. And on the top, we have some high-tech simulation where we can put people through real scenarios with patients who are very, very sick, where there might be a lot of problems that come up where the patient may even die, which we couldn't do with real people. And those are other kind of immersive active learning approaches that we use. So lots and lots of active learning going on. A lot of reflection. Reflection is used throughout health professions education. It's a requirement to write reflective pieces for part of your re-registration or revalidation as well. But it was interesting that the psychotherapists and the mental health nurses applied it at a very, very deep level where it underpinned absolutely everything that they did and how they thought. Whereas others who were more practically based, it was more a case of, oh, well, we asked them to reflect on what they thought of a teaching session. So it wasn't really deep reflection. The really, really interesting bit for me was about how they perceived agency with all this around it. And they definitely thought that they were trying to create agency, but they tended to misconstrue it. And I had a number of people that said, oh, yes, I'm very conscious that I try to create agency in my teaching. I give the students a choice of which resources they can use. So they could choose A or B. And they considered that to be learner agency, which is not quite where I would put it in terms of choosing when, where, and how you actually learn. And again, big professional differences in focus and also in terms of how they viewed agency. And a lot of the teaching approaches tended towards andragogy rather than heutagogy as well. I think part of that was due to constraints on time and resources. So in summary, we ended up with, yes, a lot of active learning going on. We really do believe that we're creating agency. We're doing a lot of reflective practice, but was it really what it said on the tin? And this was really the way that I conceived of where agency sat, that it sat in a context. Now, it will always exist within some kind of context, but the context in which it sat with my health professionals, educators, was that the boundary was the professional body requirements and the university regulations, and that sometimes those actually conflicted with each other. They didn't always agree. Now, clearly, we have to have some boundaries because we need patients to be safe. We need students to practice safely when they go into practice. We need them to behave in a way that is professional and to apply those principles of professionality, confidentiality, and all those kinds of things as well. And exactly how that plays out will vary a little bit between the professions depending on how they focus things. But how do we generate agency within that? Another thing to say within the practice requirements as well was the professional body requirements, was that there are often requirements for attendance. You must attend 100% of your course. You must attend 50% of your course. There were all sorts of different things, and they didn't always turn out the same across all the professions, but there were attendance requirements, and some of them were specified it must be face-to-face. For example, if you were studying to become a counsellor or a psychotherapist. In terms of learners, I've already mentioned they weren't really a uniform group. We had some much older ones, some much younger ones. But age and experience seemed to be important. A lot of the younger learners didn't want to become agents. They just wanted to be taught. They wanted the teacher to provide everything and tell them how to do things. Whereas the older learners were very much focused on, I've got something I really want to know about. Where can I go for the information? Can you give me some ideas and I'll go away and do it? In terms of professions, there were some differences that, for example, medicine is very competitive to get into. And often the medical students were very, very focused. They used they tried to behave in a way that was agentic to get them to where they needed to get to. And we also had other learners who were doing, for example, the paramedic program or the operating department practice program to get them onto a medical course. So they were using, their agency to get there, but that was considered quite unprofessional by the people running those courses. And we had other students were they just misunderstanding, or were they, using agency badly, as it were, where they would try to turn up when they wanted to turn up, They didn't feel that they had to go to the placement they were assigned to. They didn't feel they had to be there at the time that they were assigned to be there, and so on, which doesn't fit in with behaving as a professional and being able to work in that environment. In terms of tutors, they felt that their agency was constrained at times because they might be trying, they acted as gatekeepers of the profession. They sometimes were trying to protect their profession from a student who might be not deemed safe by practice, but the university didn't want to get rid of the student because they were getting good grades. So there were some conflicts there. And also that there was a conflict a little bit between the people in practice and the people in the university, because the university staff saw the practice educators as very much focusing just on sort of skills rather than the deeper underpinning knowledge that was needed to practice safely. So in summary, I came to two questions really, which is where I'm going to open this up to you in a moment. But there's the question around how can we foster agency in that context where we do have some quite definite constraints on what we can do. And how do we, how can we develop that learner agency without compromising patient safety? And just to finish, the two pieces of work that have been done within medicine, and the only thing that I found that have touched on this, where they're saying that junior doctors, one of the reasons they sometimes want to leave the profession is because they feel that they can't have any agency over what they're doing because of the hierarchy and because of that bigger healthcare system that they can't influence. So it's a very, very interesting question. And I will stop talking at this point and open it up to the floor. And I'm not sure how best to do this because I've got the Padlet, and I'd appreciate it if people wanted to add things to the Padlet, but there's not a big number of us, so I think we can probably just sort of also just discuss as well, which would be quite nice.
Yeah, there's, including us, 18 people, 19 people here.
Oh, there's quite a few. I can't see everybody. Okay, so I suppose the first question is: does anybody have any questions or anything that they want to clarify, or anything that they'd like to say or add?
Hello, I'm afraid I don't use Zoom very much, so I can't remember how to raise my hand. It's Colin Milligan from Glasgow. I want to take you back to a comment you said at the end, or I should say it first. I'm not a health professional, and I'm certainly not even a teacher. I'm more of a researcher, so I don't have much experience in this, but I'm interested in learner agency. So you said a lot of the younger learners just want to be taught.
Yeah.
And I suppose that's really the crux of it, is that that's almost incompatible with being a health professional, is that complete lack of agency.
Yeah.
I'm really interested in, how do you get them over the barrier to the point where they want to act like a health professional and they want to take control of their learning? Because I think that can be really important in terms of their motivation, in terms of them saying, actually, this is why I have to learn ethics, this is why I have to learn statistics, this is why, and you can really pull them through their journey to becoming a physiotherapist or whatever, through instilling agency. But I also think that there's a point at which they're not ready. Now, when do you try and pull that point forward as early as possible in their learning? So I'm interested in your perspective as
it's an interesting question, and I have some insight into it, but I don't have any definite answers. But it seems to be there's certainly something to do with age.
Yeah.
And if you think of the things that we're asking people to deal with, you're asking an 18-year-old to go into dealing with things which can be quite difficult life and death circumstances, where they may be having to, interact very closely with somebody's body in a way that they perhaps wouldn't normally do, which, can be quite overfacing for them. Some of them, particularly in the mental health end of it, we get a lot of students that step back, and they will come back later when they've, to use a bad phrase, grown up a little bit, and they feel more able to manage it. In other cases, it is about how you engage with them and work out what it is that's bothering them. So part of that is, I think, around the teaching approaches that we use. And sometimes it is developing confidence and getting them over fears, because another one you'll get is, well, I don't want to do this because if I do this in practice and I get it wrong, I might hurt a patient, which is really good. I'm glad they're thinking that way. But there's always a first time you've got to do it. And we're not going to let you do a particular skill in practice unless you're closely supervised, unless you've done it in the university and other, in other situations in practice first. You know what I mean? We're not going to just let you out there to do it. So we are going to keep a close eye on you. But yes, once you're a qualified health professional, sometimes things will go wrong. And we do spend quite a lot of time on that and looking at that, what we call that emotional labour of things. And it's really just taking them back to, this is why you need to understand about the ethics, why you need to understand about the legalities, so that you know that you're doing it right. And a lot of it is just taking them very gently. But there will always be some people that either just don't get it or they don't want to get it.
Yeah.
So there isn't an easy answer. It's just, I think, just working individually with those people to try and get inside their head and say, what is it that's really bothering you? And often it's a fear of getting it wrong.
Hello. Yes.
Hello.
Okay.
Yeah. I'm just noting you said it's resonated. So do you get similar issues with your midwifery students?
Yeah. So I'm the senior lecturer at the University of Central Lancashire. So
Right.
and I'm sat next to my colleague. She's doing a bit of work trying to whilst I'm talking. And as you were talking, I'm like, oh, Elaine's saying this. Particularly things like CBL. And when you were saying, like, we feel like the students are those, they turn into, we not call them patients because they're usually well, but absolutely, it's that extended. You still feel like you're caring for them, but I don't think that ever leaves you, does it? And I think, was it Colin's comment around, younger students, and I've never really thought about it. I suppose that it is something they need to, I don't know, I think that's part of the thing about being a healthcare educator, that you can't give them that experience, can you? But when they've had that experience, it's about trying to debrief. And so we have professional midwifery advocates, which quite a few of my colleagues are. So it's about that supervision and closely going through what happened, actually doing a reflective cycle. And I think for healthcare, it's so important that you actually do reflect and you learn from that experience. Yeah, it's different for everybody, isn't it?
Yeah, and I think that's one of the important uses of the reflection. But what was interesting in the actual research was that the different depths at which it got used. That some people, it was really very, very deep, and then there was another extreme where it was just somebody's told me I've got to reflect on it. So yeah, it was all right. I quite enjoyed it, really, which isn't exactly a reflection, is it? But
no.
So,
I think, but in terms of reflections, I think that's one of for me personally, when I've been doing some reflections, I think AI is quite helpful to prompt to make that reflection deeper, because it asks, if you type in a bit of reflection, it asks you more questions that you may not have thought to ask yourself, and digs a bit deeper. So,
that's interesting, actually. Have you tried that with your students?
Not yet. No, I was doing a bit of like a learning log, I suppose, for my master's dissertation, and it then got me thinking, like, oh, actually, that might be quite good. So I think next year, potentially, for our reflective portfolios, might be something to think about.
Yeah, that's interesting. Well, thanks for that. Yeah, I think there was an interesting difference as well with the medical students, because the medical students tended to be younger, So they were the 18, 19-year-olds, but they were also people who were very, very, very motivated. And maybe, I mean, I don't know, but maybe they wouldn't have got as far as they did and got onto the medical course if they hadn't had that ability to, sort of use their own agency to get there. So maybe that's why they got up there and others didn't. I don't know, but it was just interesting that they were quite a different group to some of the others. So there were a big difference between some of the professions. I think what I'm going to do is I'm going to have a look at the Padlet and see what people are popping on there.
There's another comment in the chat that somebody says the problem for us with first-year law students is that they actually use AI to write their reflections. For example, how to researching a legal topic. So I guess it's a double-edged sword. It can help. Also,
I think this is another one that's going to become an interesting area of debate, isn't it, as to what actually happens with all the AI stuff, because we are going to be having to deal with it. But how do we actually deal with it? I'm trying to get through to. I think I'm going to have to go back up to in the chat actually to do it. So I'm trying to get onto my Padlet. There we are. Yeah, has anybody had the experience of trying to do active learning with people, and you get the response of, "But your job's to teach me. If I wanted to do active learning, I'd have just done it myself, and I wouldn't have come in here today." Because that's one that I've had occasionally. Trying to use games. Stimulating choices, getting them to choose topics. Yeah, choosing topics for reading materials. That's really important, actually. One of my things was always trying to give people a choice of what they did for assignments. And some tutors were very good with that and others weren't, because they felt it wasn't fair if people had different topics that they were writing about. But if people are interested and it's something that fires them up, then they're more likely to do something good with it. And also, it's much more interesting as a tutor marking a variety of topics than it is writing, marking the same essay 50 times. So two of my questions on the Padlet that you may or may not have found because they're further across. It's question 5 and 6. So number 5 was about suggestions for how we might get health professions educators to help generate learner agency in the teaching. And then number 6 around how they might overcome some of the structural barriers for generating agency. So if anybody's got any thoughts on those and wants to add them, then please do. That's an interesting one. Somebody's just put in the Padlet. I would ask if our faculty, if it's possible for students to choose when to do the more generic skills. It's an interesting question. And I'm not sure how to address things like that, because certainly a lot of the courses I've taught on have been ones where there's been quite large numbers. And so everything's felt a little bit, it's had to be very, very organised. But there's always been the perception that nobody would want to do things, for example, in the evening. Or if we give people a choice, then it will turn into chaos. Whereas maybe if we give people a choice, then it doesn't turn into chaos. It just means that people get to do something at a time that suits them rather than the time that doesn't suit them. And I sometimes wonder how much of, whether we're just worried about losing control, as it were, if we give the students genuine options. And that might be something else that's behind some of the problems with trying to generate agency and give people and give people choice. Yeah, and thank you to people for attending. If there is anything else you want to add to the Padlet, please do.